Hi everyone, my name is Carly Messino. Today I'm going to be presenting on a case that for the client's confidentiality, I'm going to sometimes be calling her Julia. You will see how I engage, assess, and choose a proper intervention and evaluate Julia in the Nazareth Counseling Center. The Nazareth Counseling Center offers short-term, solution-focused mental health treatment to the graduate and undergraduate students. Therefore, the population is normally adolescents 18 years and older. Nazareth College is a diverse population, so the counseling center brings in students with all different ethnicities. When clients originally come to the Nazareth Counseling Center, they would do a walk-in consultation where they express their presenting problems. In this case, Julia came to the center because she is an African American sophomore, occupational therapy major from Syracuse, New York. She is 19 years of age and has a history of mental health in her family. She has been experiencing anxiety symptoms, which she claims have been occurring for many years. In the past, she experienced test anxiety, but has now escalated to worrying about many different things, such as school, work, family, boyfriend, and friends. She struggles to stop her mind from racing, especially at night. She has trouble falling asleep or falling back asleep if woken up. She has constant worries that something horrible is going to happen. Her father is battling cancer and was admitted into the hospital once she got to school. She is constantly worrying about her dad and how it negatively impacts her family as a whole. For the past few months, she has been feeling anxious, tired, and has a poor appetite. When asking about her education, Julia claimed that it has been hard for her to get motivated to attend class or do homework at all. Socially, she has a good support system and can go to both family and friends for support. She has noticed lately that there has also been a lack of motivation in wanting to see other people. With all of this, it is important to also do a safety examination. During this time, Julia denied all history of and current suicide idealization. Assessment part of this specific case. When both engaging and assessing a client, it is important to meet the client where they are at while working through a cultural humility lens. It is important to use empathy during the assessment phase and explore the meaning of the client's words and body language. The engagement phase is where the client and clinician first meet, so being friendly and open can help build a strong rapport. In this case, I observed the client to have a neat appearance, normal speech, normal eye contact, normal motor activity, a full affect, and an anxious mood. I also observed that Julia had a strong short-term and long-term memory. The client was very alert, cooperative, and open to attending more counseling sessions. While engaging with the client, I like to be as empathetic and culturally appropriate as possible. This means while engaging with the client, I would have to be aware of my own bias of what a family structure may look like. Julia's father is in the hospital, so their family structure has been a little rocky lately. I've had healthy relationships my whole life with my family, so therefore, I would have to be careful to not talk about that or judge her or her family's traditions. I would want to be curious about the client's unique experiences due to her Black ethnicity rather than stereotyping her. I would be there to validate, listen, and give some general psychology knowledge. Sometimes this just means saying, "Wow, you have a lot going on right now." I could imagine that would be very overwhelming. Sometimes students come to therapy just to have their feelings validated. It's also important to not react in a defensive way, but really focus on what is going on with them. Get the root of the problem. It is also important to become aware of ways in which you may be committing microaggressions. It's okay to acknowledge differences and openly express your commitment to inclusivity. In her first consultation, Julia presented with pretty generic anxiety symptoms. Therefore, I would first create a biopsychosocial assessment to really get a big picture of her and narrow down the reasons for her problems. A biopsychosocial assessment assesses for biological, physiological, and social factors that could be contributing to the client's problems. It questions about a person's mental health status, thoughts, behaviors, feelings, emotions, history of trauma or abuse, and may ask questions like, how would you describe yourself? What are your strengths? What are your weaknesses? Finding out that she is struggling with anxiety, it is time to come up with a proper intervention. It is important to choose an intervention style that is going to help your client change, improve, and grow. Cognitive behavioral therapy is often a short-term psychotherapy treatment that is often goal-oriented and focuses on problem solving. It is a combination of both psychotherapy and behavioral therapy. Psychotherapy emphasizes the importance of the personal meaning we place on things and how thinking patterns begin in childhood. Behavioral therapy is then combined and focuses more on the relationship between our problems, behaviors, and our thinking patterns. CBT's goal is to change one's thinking patterns or behaviors that are causing them difficulties. It is a way of changing one's way of thinking. For example, in this case, when Julia has high anxiety about her family, she may think, my mom hasn't called me yet today. My dad must not be okay. These thoughts may make the client feel anxious or worried that something is wrong when they don't even know if it's wrong or not. The client could respond with a further thought such as, maybe she knows I'm just doing homework, so she's waiting for me to call her. Participating in CBT and learning to change your way of thinking is an intervention to help reduce anxiety. Specifically to the Nazareth Counseling Center, another intervention tool we refer students to when they are dealing with anxiety is our Anxiety Toolbox workshop. This is a 3-session, 50-minute workshop intended to help increase your understanding and knowledge about anxiety. Students learn how to build skills in order to manage and cope with anxiety on a daily basis. Students have left positive feedback after attending this group. It is a very diverse group of students that allows them to see that others who may appear different from them are going through similar struggles each and every day. This then leads us to the evaluation stage. Here's when you want to ask yourself, how are we evaluating our clients to make sure our interventions are actually working? When clients are experiencing anxiety symptoms, we have them fill out a GAD-7 prior to their consultation. This allows the clinician to get an idea of the severity of the client's anxiety. The GAD-7 is an assessment that asks the following questions. Over the past 2 weeks, how often have you been bothered by the following problems? Problems such as feeling nervous or anxious, worrying too much about different things, etc. Clients answer these questions with the options of not at all, several days, over half the days, or nearly every day. Scores of 5, 10, and 15 are taken as having mild, moderate, or severe anxiety. After getting that number, a proper intervention is put into place. After weeks of participating in the client's intervention, we ask that they fill out the GAD-7 again to see if anxiety levels have gone down, remained the same, or escalated. The GAD-7 is available for all students no matter their ethnicity. The assessment comes in all preferred languages. Allowing the client to self-report to you during therapy is another crucial importance to identify anxiety disorders. In this specific case, it is important to note that African American youth are impacted by a number of societal factors that place them at a higher risk of developing behavioral disorders. Therefore, in this situation and every situation, when evaluating, it's important to be culturally competent. This will allow the client to feel more open and have a better relationship with you and have it easier for them to express their true feelings and evaluate how they are truly feeling. That is how I would assess and evaluate a client using cultural humility. Thank you so much. And here are my references.